Can a dog give a human an infection? Dogs are a major reservoir for zoonotic infections. Dogs transmit several viral and bacterial diseases to humans. Zoonotic diseases can be transmitted to human by infected saliva, aerosols, contaminated urine or feces and direct contact with the dog. Can a dog get a bacterial infection from a human? However, potentially serious skin infections can occur if the bacteria enter through a break in the skin. Dogs can potentially get MRSA from humans who have the bacteria on their skin. In dogs, MRSA can cause infections of the skin, respiratory tract, and urinary tract. Can a sick dog make a human sick? So, can you get sick from your dog? The answer is yes. There are a number of diseases you can contract from your pet, and they are known broadly as zoonotic diseases. The word zoonotic is used to designate any disease that is transmitted from animals to humans. Is dog urine harmful to humans? The sharp smell of pet accidents, particularly pet urine, is indeed an irritant to the lungs. Inhalation of even low concentrations, 50 parts per million, OSHA's exposure threshold limit, can cause rapid eye and skin irritation. How do I know if my dog has a bacterial infection? Dogs who are sick with a bacterial infection usually have digestive upset, diarrhea or vomiting, a fever and are lethargic or cranky since they do not feel well. Dogs are man's best friend, but recent reports served as a reminder that they carry bacteria in their saliva that can cause disease, and even death, in humans. What is Capnocytophaga canimorsus? Canimorsus is a bacteria that commonly is found in the mouths of dogs and cats. It does not make dogs or cats sick but in rare cases has caused disease in humans, especially people who are asplenic, do not have spleens or have a weakened immune system. How do people become infected? Clinical disease is rare, but people can become infected with Capnocytophaga bacteria through bites, scratches or close contact with dogs or cats. Most people who have contact with dogs and cats do not become sick from Capnocytophaga. People with weakened immune systems who already have difficulty fighting off infections are at greater risk of becoming ill. Are these infections a serious problem? Typically, Capnocytophaga does not cause disease in humans, and most human contact with dogs and cats, even through bites, does not result in illness. However, in rare cases, people can develop illness from this infection. This is most common in people who are asplenic, have a history of excessive alcohol use or have a weakened immune system for other reasons, for example, people who have cancer, HIV, liver disease, or take certain medications like steroids that make it more difficult to fight off infections. In the rare cases when illness disease develops, it can be serious and rapidly fatal without antibiotic treatment. Most people who become ill will begin showing symptoms within 3 to 5 days, but this can range anywhere from 1 day to 2 weeks. Signs and symptoms can include blisters around the bite wound within hours, redness, swelling, draining pus or pain at the bite wound, fever, diarrhea and/or stomach pain, vomiting, headache and/or confusion, and muscle or joint pain. Approximately 3 out of 10 people infected with Capnocytophaga die, and some infections can lead to death in as little as 24 to 72 hours after symptoms start. If someone does develop clinical signs consistent with Capnocytophaga infection after a dog or cat bite or contact with their saliva, they should seek medical care immediately. What is the incidence of infections per year? Capnocytophaga infections are not nationally reportable, so there is no national estimate of the number of infections that occur every year. Additionally, Capnocytophaga can be easily diagnosed by routine microbiology laboratory tests, so many cases of the disease are likely diagnosed and treated by healthcare providers without ever being reported to CDC. MicrobeNet, CDC's online reference library, has received reports of 12 positive cases in the past year. These are likely only the most severe cases or those in which diagnosis was complicated for some reason. However, these do not include the most recent cases that have been reported by the media. What do pet owners need to be aware of? Many dogs and cats have Capnocytophaga in their mouths, normal oral flora, and it does not cause them illness. Animals can be tested, but a negative result may not mean the animal will always be negative, and the same is true for a positive result. Although animals could be given medicine to kill the bacteria in the short term, they can still get the bacteria again through contact with other animals. It is important that people with weakened immune systems take this into consideration when they are considering getting a new pet. However, it is still important to emphasize that most contact with dogs and cats does not result in a Capnocytophaga infection or any illness.